You all are going to be doctors and you have to interact with the patient one or the other day. He comes with several complaints. Among that, you have to come to one diagnosis. So, studying all the MBBS books is enough for that? Or does a doctor need something else? Hi, Namaskara. I'm Murali PM, a third year MBBS student from Bangalore. If studying was the only criteria to become doctors, then by this time ChatGPT would have replaced doctors. But it couldn't. Why? Why? Because it lacked that one important skill. What is that skill? That skill is clinical skills. This is a skill which makes a good MBBS student to a best MBBS doctor. Then, how can you learn these skills? The easy answer, by attending your clinical postings. So, stay till the end so that you get to know everything about the clinical postings. First of all, what is clinical postings? Once you enter your second year, you will be exposed to the patients as well as to the hospital environment, where you can develop your clinical skills. Next, coming to how can I utilize the clinical postings efficiently? In this segment, I'll start with some basic skills of the doctor. Then I move forward to some advanced skills. First of all, utilize the postings to get adjusted to the hospital environment. Yes, many of us are not comfortable being in an hospital, but being a doctor, we have to be there. So, attend your clinical postings so that going to the hospital not only becomes your habit, but being in the hospital becomes your habitat. Utilize your postings to empathize your patients. Yes, we are Gen Zs who born and brought up very comfortably by our parents. Except one or two, many of us cannot empathize our patients. Being in someone else's shoe and understanding their pain and suffer comes with some time and experience, which you can get from your clinical postings. Next, utilize it to learn from your seniors or your senior doctors. Yes, when you are posted in a clinical posting, you are not only exposed to the patients, but you are exposed to your friends, your seniors, PGs, and your senior doctors. You can learn from them as basic as the dressing sense. You might be wondering, dressing sense? Yes, we all are in a professional course. So, our attire should describe us. I'm not telling here to buy some expensive clothes. I'm just telling you wear clean and neat, well ironed clothes. Then what else can you learn from the doctors? The way they speak with the patient, the way they console their family members, the way they interact with the patient. Yes, consoling is actually a life skill. If you are someone like me, I suck at consoling people. If someone is crying there, I'm very bad to tackle that situation. I don't know how to console that person. But it's actually a life skill which a doctor should adopt. So gradually, I'm learning that in a process. Imagine a situation where you have to announce the death of the patient to their family members. How will you handle this situation? Here comes the consoling part, which is very important skill for the doctor. If you are enjoying this video till now, subscribe to my channel so that I come up with more amazing videos, and share it to a friend who always skips clinical postings. Next, coming to number 4, communication. Once you enter clinical postings, you'll get to know that you have to ask them uncomfortable questions to the patients. Like you have to ask them about the contraceptions they are using. You have to ask them about the bowel and bladder movements. The patient won't be knowing what is bowel and bladder movements means. So, you can't ask the patient directly that did he poop 2 times a day or not. You have to be professional while asking these questions. Next, coming to the very important, utilize the clinical postings to evolve yourself to be a good doctor. I'll give you an example of 3 students. One who is very good at clinical skills. He is very active in the postings and he performs all the percussion and auscultation on the patient. But he didn't go back and study the topics. Here comes the second person who is very good at theory part. He studies about all the pathogenesis, he studies about what and all happens in where and all, and he knows everything. But he don't know how to percuss and he don't know where to auscultate. Next comes the third student who is pretty decent at clinical field. He know how to percuss a patient, he know how to auscultate the patient, and he also know when and where what he hears or what he feels. So, whom do you think will become a good doctor? According to me, the third person will become a good doctor. Imagine yourself sitting in an OPD and a patient of pneumonia comes to you. You have learned all the theory part of pneumonia. You know there will be OT dullness on percussion in the pneumonia. But you lack the clinical skills and you couldn't perform the percussion on him. Then, is there any worth becoming a doctor like that? One of my senior doctors told this line which stuck in my head. Your eyes can't see what your mind doesn't know. Yes, I'll repeat it again. Your eyes can't see what your mind doesn't know. This means you have to have 50% of the theory knowledge and other 50% of the clinical knowledge. If you know there will be OT dullness on percussion, but you don't know how to percuss the patient, there is no use. And you know how to percuss the patient, but you don't know what all happens in the pneumonia, then also there is no use becoming a doctor. So, utilize your postings wisely. Learn to interact with the patients. Learn to empathize the patient. Learn all the necessary clinical skills and become a good doctor. If you have any more doubts, feel free to ask me in the comment section. And do subscribe to my channel. See you in the next video with a new concept. Until then, Namaskara. Bye bye.